Pertussis. What is pertussis? Pertussis is a very infectious disease within the respiratory system, caused by the bacteria Bordetella pertussis. This bacteria attaches to the cilia that lines the wall of the upper respiratory system and damages it by releasing toxins. This causes the airways to swell and produce a whooping noise, hence giving pertussis its other name, whooping cough. Stages of pertussis infection. Pertussis has three phases of infection: catarrhal, paroxysmal, and convalescent. In the catarrhal stage, pertussis generally presents itself as a common cold, with symptoms such as sneezing, nasal congestion, watery red eyes, and occasionally a low-grade fever. It lasts for about 2 weeks, and at this point, pertussis is very contagious due to the huge presence of bacteria in the tract. It is followed by the paroxysmal stage, which approximately lasts for 2 weeks. During this phase, symptoms persist due to the damage caused by the bacteria when it was thriving. The most notable symptom is when a person gets paroxysms, a long-lasting, hacking, wet cough. This is followed by a whooping noise caused by the swollen airway and may even result in vomiting. Young infants, however, have gasping, apnea, and due to the increased oxygen level, they have an increased risk of pneumonia, seizures, and death. Finally, there is the convalescent stage, which lasts from 2 to 3 weeks, depending if relapse occurs. During this stage, cough slowly dissipates, paroxysms and whooping fade away, and the airway starts to heal. Antibodies in the pertussis vaccine prevents the contraction of the infection and lessen the symptoms if it does happen. It is the cheapest evidence-based approach to prevent contraction of pertussis, as it can be obtained for free and available through school-based programs, general practitioners, and some local councils. Pertussis vaccine is often given as part of the DTaP and Tdap vaccines. DTaP stands for diphtheria, tetanus, and pertussis, and is given to children younger than 7 years old, while Tdap stands for tetanus, diphtheria, and pertussis, and is given to teens and adults. These vaccines are greater than 90% effective in protection against pertussis, which is why it is recommended for all babies, children, teens, adults, and pregnant women. The main treatment for pertussis is macrolide antibiotics such as azithromycin and erythromycin, which are used when the bacteria is still thriving during catarrhal or early spasmodic stages. The treatment for severe cases of pertussis is extracorporeal membrane oxygenation, or ECMO. It is a machine that substitutes the heart and or the lungs of the patient that have progressed onto the severe stages of pertussis. It is the most expensive evidence-based approach with an average cost of $73,000 of the procedure itself, excluding other costs associated with the treatment. It is not recommended, however, due to the high mortality rate of patients that have undergone this treatment. Parents or caregivers alike should undertake the following approaches to ensure the prevention of contracting pertussis and transmission of the bacteria to others. Infected children should be excluded from school for a period of 14 days if they have not received pertussis vaccination or completed antibiotics treatment. Children should be immunized on time. Watch out for symptoms and seek medical advice immediately if symptoms start to develop. Ensure children practice good hygiene by washing hands regularly, covering mouth and nose when coughing or sneezing. Last but not the least, keep away from irritants such as smoke, dust, and chemicals.